Namaste and welcome to another episode of Reflecting with AINA. Today I have the pleasure of introducing a very special AINA member, Dr. Reeta Achari. Dr. Achari is currently the president of the Texas Neurological Society and runs a successful private practice in Houston, Texas. She's also adjunct faculty at UT McGovern Medical School and specializes in different fields of neurology, including Parkinson's, Alzheimer's, other movement disorders, concussion, migraine, but most uniquely, nutrition in neurology. She has published many articles and podcasts on this topic. And it is my pleasure to welcome her today to share some of her experiences with AINA members on our podcast. Welcome, Dr. Achari, and thank you for taking the time today.
Namaste, and thank you for having me here. I'm really delighted and honored to be on this podcast. Thank you.
So, we always, with all the members we have, it's always interesting to hear how their early experiences influenced them to choose the field of neurology. So would you like to share some of the early exposures or influences that led you to choose neurology as your field?
Sure. The same influences almost made me not want to be in neurology. So it's an interesting thing. So my father is a neurologist. So I grew up as the child of a neurologist. As early as in elementary school, I remember doing a science project. My father is a neuromuscular specialist, so doing nerve conductions on my brother, doing what happens to the nerve when it's exposed to cold and heat, and how that changes. So I've been interested in it for a long time, just because that's the language that we spoke at home is neurology. When I went to medical school, my first rotation was trauma surgery, and I was the most non-invasive person, but I was completely taken by surgery. I think I really liked the adrenaline of it. I liked the acuity. I liked the ability to do things. And when I was going through, I really started to apply to be a surgeon, and my classmates actually did an intervention. And I didn't want to go into neurology because my father was a neurologist, and I thought, well, I'm never gonna, that's dad's thing. So they sat me down and they said, you're the person we come to when we have a neurology question. So please get over your issues and go and be a neurologist. And so I did my neurology residency and then my epilepsy fellowship. And after that, joined my father in. So things were, I think, the way they were meant to be without me knowing it.
That's very interesting, and I'm glad that you chose the field of neurology in a kind of a roundabout way. But it's a blessing to all your patients. So, and what a career you've had! You've had such a successful, not just in clinical neurology, but in leadership. Being involved with the Texas. I know you're very highly involved with the Texas Neurological Society, and now leading the organization. How do you balance these roles, and tell us a little bit about your journey and kind of how you're so successful, with a busy private practice and still being able to lead such a big organization?
I will start by saying I have a lot of help from staff members in all the different organizations, from my fellow neurology colleagues, and a wonderfully supportive husband who allows me to do these things. I think it's very interesting that we as physicians are removed from policy, and yet we understand now, all of us do, how much policy and politicians affect what we do in our ability to care for our patients, right? So I started early on in medical school being involved in the Texas Medical Association and the American Medical Association, the AMA medical student section. And at that time, this was, the 90s, the Texas coalition of medical students, we are the ones that wrote the needle stick policy that then went on to become national needle stick policy. So it starts with one person getting stuck and going, hey, what do we do now? And medical students are wonderful because they see things in a different way and they're not jaded. So that's how I got my start. I've had people through this journey keep me involved. And then I went from advocacy more into education. And this is something I get directly from my father and my maternal grandfather, that if you are part of a community, that you must be of service. Do something outside of just your part. Go and be of service. And just as you would like people to educate you, go and help others be educated. So there is no time. We all have the same amount of time. I just choose to focus a little of that time on being involved with the Texas Neurological Society, with being involved with the Academy, with AINA, because you give a little of your time and you get so much back, right? Through friendships, through learning, through connections. So I just try to put a little time aside for that. And that means there's probably something I'm not doing that I should be doing, but I enjoy it.
Well, I think you're doing plenty of service for everyone. So that's wonderful. And that's a wonderful way of thinking about it. So, and the first time I think I met you, we met briefly at one of the AINA meetings, and we talked a little bit about what you do. And you mentioned that you had some early experiences with Ayurveda through your personal family, and then how you got interested in nutrition. And it was very fascinating to hear kind of somebody's doing nutrition and neurology. I had never heard of it. So I'm very interested in hearing about how you kind of got interested in this field and how you learned more about it, and how are you helping the community and your patients with nutrition and neurology.
So, when I get asked this question, my answer is always that all neurologists are nutritionists, right? The number of illnesses that are nutritionally mediated, that their first presentation is a neurologic sign or symptom, right? Whether it's beriberi, right? So in fact, I just saw a man who has both dry and wet beriberi. So he had encephalopathy, peripheral neuropathy, and then had a sudden bout of congestive heart failure. And what was fascinating is they actually diagnosed, because they had a low B1 level, they gave him the B1. He came out of the hospital, he was a little bit better, and then he got a little bit worse again, as his diet is just not great. So his daughter brought him in. And, here is a potentially treatable cause, 3 things with 1 vitamin. So, this was our first exposure to disease. My grandfather, I'm going to talk just a little bit about my grandfather. So I think about my grandfather, who I come from a small town in northern India, and he was the town physician. And I think about the fact that he, and even my father, these are people who, this was before the time of Tylenol, right? There was aspirin, there was penicillin, there were some other older medications. People got sick. They didn't have MRIs. They didn't have all of the wealth of, we have 20,000 approved FDA drugs in this country, right? And yet those people got sick, but they got better, and they were treated with simple things. They were treated with herbal cures, tonics, mustards. They were treated with food. And then they were treated, of course, infectious diseases with the antibacterial and antifungal treatments that they had at that time. But so many illnesses, and my wet beriberi, dry beriberi diagnosis is only because I've heard my father talk about being in a tribal area where they drank a certain kind of alcohol, local alcohol, and he would see the jugular veins and he knew it was B1 and they would give B1 and he would clear up the congestive heart failure, right? So simple things. We know about vitamin B12 deficiency. We know about the link between folic acid and spinal cord. We know about vitamin D and white matter. So it just continues. We probably now are finally learning about choline and the fatty acid metabolism within the mitochondria. And we've got an NIH-sponsored trial looking at choline as a possible Alzheimer's prevention drug, right? So I think that if we look for it, it's going to be there. There are always some nutritional deficiencies. My interest in Ayurveda, comes from, again, I have a great uncle who's an Ayurvedic physician, but also in my father's village. His grandmother had all sorts of interesting remedies. If you had constipation, this was the remedy. If this, simple things, right, that were food based. The idea of the principles of Ayurveda. So I don't practice, I'm not an Ayurvedic physician, but the nice time sitting down with my dad and reading within the Atharva Veda Ayurvedic principles. And I think when you do that, I'm not practicing herbal medicine, but I'm using the basic principles of promoting health, right? Instead of feeling ourselves as sick or talking about food as medicine, we talk about food as nourishment, food as nutrition, and then it becomes a lot more fun than trying to eat a superfood, right? So I think that the way I came to all of this, I had that background. All of us as physicians probably don't eat very well. I know in training, my diet was deplorable. When I started my practice, it got even worse. I was known as the Frosted Flakes girl in the cafeteria because I would run in and do my Frosted Flakes and keep going. But then as you get older and as our population is aging, we're noticing this too, that I started to feel ill, right? I wasn't feeling well. And really there was no clear, and I wasn't sick. I didn't have any big illness. And I finally had somebody check my vitamin D level. Vitamin D was becoming popular at that time. And my level was really low. And I gave myself some vitamin D and wow, I felt so much better. That became sort of my first inclination of, oh, wait, I should start eating well. Maybe that helped me. And it did. So over time, I sort of translated that to my patients. So my first real nutritional neurology case was an attorney who had vitamin B1 deficiency that had gone undiagnosed. It took a while for me to understand that he had a gluten-free diet and he really wasn't eating well. We diagnosed his B1 deficiency. I gave him some injections. We gave him a good recipe and a good place to find flour so he could bake bread. He baked bread for me for like a year, and then he's well now, so he doesn't need me. But that, and then vitamin C deficiency. I mean, who the heck thinks that there would be a vitamin C deficiency in 2023 in the United States? And yet the FDA, through actually the CDC, knows that almost 50% of the population is vitamin C deficient. So, and that's critical for neurotransmitter production, right? Because if you look at the cellular chemistry of neurons, you will find that their vitamin C is there at 100 times the concentration of any other cell. So we think of it as food, but really it's micronutrient, which really is biochemistry, which really is neurology, right? So I think we don't spend a lot of time in medical school. We don't spend a lot of time in training. So I did have to train myself. The other part of this is our culture is a very sophisticated pharmaceutical culture, and to talk about micronutrients seems simplistic, and yet it's really fundamental. And I think if we can, I use the term nutritional neurology, I really should be talking more about cellular biochemistry. And, I told you I didn't want to be a neurologist. I have a biochemistry, molecular biology degree, and I didn't really want to go back to biochemistry, but here I am. That's what I'm doing every day, is studying, the horrible, the metabolic pathways chart is like my friend. I have it in my office over there. So,
Oh, yeah. No, I think this is really very interesting how you talk about. And I think, we all learn the biochemistry and the pathways and the micronutrients in medical school. And then we kind of, as we drift through neurology and then super specialized in epilepsy or whatever we do further, I think we get further and further away. I definitely don't remember any of those pathways. And I think the deficiencies only remain as board questions in our brain. And and you say we all, as neurologists, are nutritionists, but I feel like we don't often think about, yes, for obvious cases, sometimes we'll ask about sudden weight loss or special diets. I think we've learned that to ask for those, but for general well-being, and I think slowly from that, I think there's being a slow shift. I know in the Indian culture, it's always been there where it's prevention, where Ayurveda also focuses more on prevention rather than treating disease, through your diet and your kind of daily habits. You're trying to prevent disease rather than treat it with allopathic medicine. So, for young neurologists who are listening to this, or, aspiring neurologists who would be interested in incorporating this, do you know if there are any formal like training or courses, anything that is available? Or if I know you've had to do it all on your own, but I don't know if you know of any available resources.
well, the way that I do this, right, is I measure levels of things. And so it's not a general sort of lifestyle medicine, what I would consider it's just a far more precise way that I'm doing it, because I think if I'm doing this and I want to know what's going on inside the cell, I want to have levels. I'm a data-driven person.
Mm-hmm.
There is no clear textbook to guide us through this. I'm hoping that if I have a little time, I can even write something small to get people started. I think, though, if you start with Victor and Adams, start with a good neurology textbook. The Victor and Adams from 30 years ago, the chapter on nutritional diseases was 2 or 3 pages long. Now, I think it's about 15 pages long. And one of the great statements in the most current edition is that if you have one deficiency, you are likely to have more than one. And subtherapeutic levels, right? So insufficiency states of multiple things can also cause neurologic disability, right? Neurologic symptoms. So think at least to check the blood levels that are easy to check, right? We all know how to do B1, B2. B2 is an amazing story on migraine. The paper about vitamin B2 and migraine, I found that in my practice, those patients who respond to B2 are usually the ones that are deficient in B2, right? So now we know which patients were the responders. But you can check a vitamin C, you can check a vitamin D, vitamin B6, we all know about, both subtherapeutic levels, so deficiency and toxicity can cause neuropathy. So, you've got plenty of things that you can do. Just think about it, right? I just told you about the gentleman with the B1 deficiency. I saw a lady with greater occipital neuralgia, again, with a B1 deficiency, but she has ovarian cancer and she's undergoing treatment, and she's developed, chemotherapy induced peripheral neuropathy. But what's fascinating is as we're treating her with her micronutrients, if we're giving her all of those back, her neuropathy symptoms are better, right? So if you think about the neurons, the fact that they are voracious, right? They need far higher micronutrient levels than anything, because we're always working. My brother, the cardiologist, will say the heart needs more, but I'm going to differ with him and say that the brain needs more. I think if we just put that as the first step, right, before we reach for the drug, think about, okay, what are the energy stores in the mitochondria doing right now? And can I improve them? Because then neurologically, people are going to get better. Even their medications are going to work better. So there's no clear way of doing this. Start with the basics and just think about it. Think about the simplicity of starting foundationally in terms of nutrition. Think of the cell. I do sound like
so biochemistry, right?
I just sound like a biochemist again. But yeah, think of the cell and think of what's happening in the mitochondria. And you've got to have glycogen, you got to have free fatty acids. So how do we make all those things? And our patients, we don't eat the same. I don't eat the same now as I did when I was a child. I don't eat the same way as I did even 10 years ago. And so our dietary practices are changing. And of course, people are on a variety of diets that are restricted in some way. And people will tell you things like, oh, really clean. Well, what does that mean? Right? I'll tell you what it means to one person. It means eating grilled chicken and frozen broccoli every day. Think about that man's nutrition. Right? It was terrible, but he thought he had a great diet, right? So the other thing I am writing a small little thing on how to take a dietary history. You can't just say, do you eat well? I actually break it down and say, what did you have for breakfast? What did you have for lunch? What did you have for dinner? Oh, I get takeout. Where did you get takeout from? And then I normally have people keep a 2-week pictorial food diary that they send to me. If you have people write it down, they change immediately what they're eating because they're thinking about it. Taking a picture doesn't seem as invasive or judgy. So I use a pictorial food diary for 2 weeks, and it really helps me. I would also like to say that I find that things like the Mediterranean diet as the only thing that is going to save our brains, I find that an inherently racist thing. It's very colonial. Your ancestors, my ancestors in Southeast Asia, the people in China, the people in Japan, the people in Africa, the people in South America, Central America, even North America. Our ancestors also have longevity and they also have good neurologic health and good memories, but we don't have to eat grilled salmon and asparagus, right? Our food culture is different. And one of the things that we haven't done, see, I go from one thing to equity and inclusion, is we have to be culturally sensitive when we're giving dietary advice. We have to make it palatable and nurturing, and we have to speak the language of the patient, right? So, even for me, I mean, my family is a sort of strange family. Part of my family comes from the southern tip of India. The other part comes from Bengal, and then I was born in Bihar. And so I know that the foods are completely different. And what I've done is at least learn as much as I can about food so that my Gujarati patient, to get her out of the hospital, I had to make her khichdi, give her a khichdi recipe because she was totally bedbound, right? So I had to get her healthy, and that's how we did it. So it may sound like a crazy thing, but it's not. She's vegetarian, so I changed her khichdi from a 1-to-1 to 3/4 dal to 1/4 rice, right? And then we added some nutrients. We added some more greens and things in there to make life easy for her. So, so I know I sound kind of crazy, but all I care about is that my patients get better, like all of us. And sometimes we have the knowledge that no one else has. We should use it. And so that's what I've been trying to do. And I think it's easy if we just take a little time. That sounds easy. We don't have any time, but that's what we need. It requires a little time, or requires a little knowledge. It requires looking at a few things, and then it's not that hard.
No, I think that's a valid point. Just And that's why your role is so important, and kind of that awareness, like I said, we all learn it, and we've all, studied for boards about it, but then we kind of forget about it. Just thinking about a recent case, because in pediatrics, we never think about thiamine deficiency. It's the alcohol drinking people who, but we recently had one with ulcerative colitis who just lost a lot of weight due to malabsorption and came in with bilateral sixth nerve palsy, altered mental status, headache, and everybody's thinking raised ICP. Nobody's thinking B1 deficiency. And turned out, the smart neurologist checked it, and, she got better with thiamine injections. So I don't think that's, especially I feel like as pediatric neurologists, we never think about B1. And that just taught us that we need to go back to thinking about vitamin levels and nutrition too. So I think that's why, you talking about this, and hopefully everybody, kind of thinks takes a few minutes for every patient to think about their nutrition a little bit.
Yeah, what a lovely case, that you're just spoken about. That, yeah, it is something where if you just think about it, and if it becomes part of your routine of saying, aha, it doesn't matter whether it's cortical or down to the peripheral nervous system, right? Let's just check these things, right? That's how I got into it, which is, wow, how on earth am I finding now? I've got my little board over there because I've got my 7 B1 deficiencies in the last month, all of them with different circumstances, right? And just make it part of your daily awareness. It's like almost like a mantra, and saying, okay, in this patient, I'm just going to check these levels because they can cause all these things. Once we start becoming more aware, it's amazing, what we find. And it's the Oslerian statement, right? When you say, well, I've never seen that. Yes, you've seen it, but you didn't recognize it, right? So again, if it's in the forefront of our minds, then we will learn a little bit more and be able, again, this is cheap treatment, by the way.
Mm-hmm. Definitely. And not very invasive. It doesn't have side effects like our other meds. And I think, it would be, hopefully we can get the copy of your, once you finish with how to take a good nutrition history. And sometimes it like for our autistic patients, their diet might just be chicken nuggets, but we don't always ask and we don't always think. And it's easy for us to tell the parents sometimes, or, people taking care of elderly patients, like, oh, they just need to eat a good diet. But sometimes just giving them a few tips and ideas, or maybe even meeting with a nutritionist and saying, hey, they can go over what are the things that they need to be eating. So,
yeah,
I think everybody.
Yeah, no, I think exactly. Those tips are really important, right? So just general statements don't work. You have to actually say, do this, 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 right? I just had a gentleman who, anyway, he's here for a variety of things, but he wants to make his health better, and he drinks a Pepsi every day and drinks 2 Minute Maid lemonade. So we just, I gave him a little, just from the internet, a good lemonade recipe. We're getting him little IKEA bottles. So he's going to make his lemonade on Sunday. He's going to put them in those little bottles, and he may have 1 Pepsi every other day, lemonade every other day, and 1 day water only. Right?
Yeah.
How long that didn't take long?
Right.
But you've got to get people away from those bad habits, and he wants to do it. He just didn't know how. Right. So, but yeah, I think also that you're talking about children with autism, young people with autism. I see quite a few because of what I do, and it's been amazing. And I have no double-blind controlled study to say anything about this, but I know that when we check their levels and we optimize their nutrition, since one of my sweet patients and friends, he eats French fries, pizza, and that's about all. Just cheese pizza, right? That's his diet. So he was okay when we supplemented his nutrition properly, and he's okay. It's really interesting. I can check his blood twice a year. I've got to deal with him. We calm him down. We give him an extra pizza. But he has done so well now that he's actually going to be graduating a digital sort of a graphic arts cinematography program at the local arts university, right? A lot of help from his mom and from his family. But, I saw him yesterday and he popped out of his room and said, Rita, what are you doing here? This was a guy who would never talk.
Yeah.
Right. And I'm not saying that what I did that, but his mom sure thinks it did. His mom sure thinks that when he goes away and if he misses his vitamins, that he isn't quite as sharp. So I would love to do some trials.
Maybe at the time.
And that'd be great. But one of you lovely, brilliant people can do this trial, right? But the other thing we do have to know is that we can't, inside the cell, you can't just fix one thing and expect a good outcome, right? That's not how it works. And I think that's been a big problem in nutritional research, is that we, in our very tremendously important drive for the scientific method, we've also forgotten the cellular biochemistry and the mechanisms. You can't, just put gas in the car with 4 flat tires and expect it to go. So we've got to also rethink how we're doing good nutritional research. And I would love to see you, the next generation, do some of these things because it would be such a great service to patients, but also to us as physicians to sort of go back to basics.
Oh, well, I'm sure people will be reaching out to you with some plans. So be ready to get busier. So it clearly tells us you're a foodie and, you're this interest, you have a passion for it. But I also recently, after reading your CV, found out that you are also talented in dance and you have choreographed several programs. Tell us a little bit about that.
Yeah. I started life, I told you, in India, and I studied Kathak at that time. And then I left India and I went to England at the age of 5. And so there was a gap there. And when I came to the United States, then I started with ballet here with Houston Ballet Academy in the early 70s. And I was part of that dance program there. And then sort of moved and I continued to dance. The first woman who came to teach dance here in Houston, Ratna Kumar, is my guru. So she taught me then Bharatanatyam and Kuchipuri. And then before my life as a physician, as a young person in college, in fact, if you knew me from college, you wouldn't think I had anything to do with medicine. I was just known as a dancer. So I was very serious about it, would have done it professionally if my father would have even thought about it. But, there's no way that's going to happen in a science family. And so, and I continued to dance, to take class, to perform. And then even the first few years of practice, I continued to do some choreography for local theaters. And so it's lovely. But it's been 25 years and I haven't done it. And even though it's a well-kept secret here, since I'm on your podcast, I am going back to dance. So I'm very excited after, a long time to go back. It's an interesting thing throughout our careers, right? We are all so many different people throughout our lives. I'm at the stage of my life where I'm trying to bring all of the different me's back together. And it's fun because I've forgotten some of them. And so I'm being reminded. But yeah, I love all forms of dance. And in fact, I was speaking to somebody the other day who's a Odissi dancer. And so I would love to take a class or two from her and see if I can't get back into it. But it's great exercise, good for the brain, learn something new.
So good food and good dance is kind of the secret to a healthy brain.
Yes, eat well, move well, but the other part is the sleep, right? We all need sleep and rest. And those are two different things. That's why they're called two different things. But I think that's a big struggle for all of us, is our ability to give our brain rest so all that amyloid can be cleared, you know. So we've got to work on that. I'm still struggling with that.
Well, you are a busy woman, and I mean, so many wonderful talents. And thank you so much for taking the time and sharing some of that information with us. And whenever you have your performance, maybe share it in AINA Tarang or the newsletter, and whoever can, if it's online, we could watch, or people in Houston can come watch. So thank you really
Well,
much.
that would be, yeah, that would be incredible. But I think we should be doing more of that at our AINA meetings, right?
Yes,
We've got
we need to plan a talent show.
We have so many talented people that it would be lovely. I would love to hear some of the
I'm
singers.
sure our meeting will go late into the night. Like you said, so many talented people. And somebody mentioned there was Bollywood music was missing in the meeting. I'm like, yes, that is true. We needed some music. So
that's true. That would be great.
I'm sure our president and the planning committee are listening, so they'll have some ideas to work on.
Well, I think, you know, I'll tell you the other part of this. I'm so happy that there is AINA. I you know, I became an AINA member because my good friend Rob Bakshi, we were at an AINA meeting together, and he said, "Oh, you need to come and come to the AINA meeting." And I said, "What's AINA?" He said, "What do you mean, what's AINA?" So he told me, and so I went over and I signed up for a lifetime membership, and he said, "It's good Indian food." And I said, "But Rob, I'm not an Indian neurologist." He said, "You're Indian and you're a neurologist. You're an Indian neurologist." And so AINA actually has been quite instrumental in my thinking. Again, I told you about bringing my cells together, bringing all of that part of me, the Indian part of me, since I came to the US at a time where we just tried to assimilate and leave as much of our otherness behind. It's been a lovely thing to bring it all back together, and who I am culturally, who my ancestors are, and how we do all this. So I'm very grateful to the organization and to meet everybody and just sort of reinforce my cultural identity has been really lovely. So sometime maybe AINA can also influence the AAN to maybe have a diversity day where we all dress in our ancestor or our clothing from our place. Wouldn't that be fun?
That would be amazing. I think AINA can start that. We can all plan on doing a sari day or a Indian dressing day.
Lead the way.
No, but the point you made, I think all of us that are AINA members feel that AINA is an instrumental part in kind of making us feel that we belong and kind of our roots and going back, even because then you're not feeling, you know, and also opportunities to give back. There are many opportunities. There are a lot of new subcommittees and people working on how we can help educational and other ventures back home and give back to our community that some of us trained back there, and people that even trained here, you know, whose relatives and roots are still back there, to kind of give back to the community. So if you're not a member or you have friends that are Indians that are not members, encourage them to join. And hopefully we'll watch Dr. Achari perform her dance performance at the next AINA meeting.
Don't hold your breath on that one.
Thank you so much for your time. I know you have a busy clinic day, so thank you for taking time out and talking to us and sharing all the wealth of knowledge.
Geetanjali, thank you so much for inviting me. I'm absolutely honored, but really even more delighted to see you and to have a chance to talk to you. And I look forward to seeing you next year in Denver.
Yes, always a pleasure. Namaste and have a good day.
Namaste. Have a good day. Bye-bye.